Knock, 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 knock. Hi, my name's Alyssa. I'm going to be your nurse today. I'm going to be starting an IV and giving you some IV fluids. I'm going to be sure and follow all of my general principles and safety practices, follow my 11 rights of medication administration, and explain the procedure to the patient. Can you tell me your name and date of birth? Double check that with the bracelet. Do you have any allergies? No? Okay. So I'll go ahead and get started. I'm gonna do my hand hygiene. First things first, I'm gonna get the medication ready. When I take my tubing out, I'm gonna be sure that nothing touches the end of this tubing that will hook to the patient's IV. Make sure it's all entangled. Take the cap off. I'm going to push this in here in a downward motion. There we go, popped in. I'm going to make sure that my tubing is completely clamped off. And then I'm going to invert my bag and hang it. And again, hang this without anything touching the end of it. I'm going to squeeze that. Then I'm going to take this and over the trash can, take the twist the cap off and prime my tubing. So unclamp this. And I'll do this over the trash can, but you're going to be sure that it doesn't touch anything. Nothing can touch that. There's no air bubbles. So it's primed and ready. So I'm going to put the cap back on without touching the top. Perform hand hygiene.
What the heck?
Now I'm going to lift the bed to a good working height. I don't think this bed's plugged in, but if it was, I would lift it to a good working height. Put my tourniquet on. I'm gonna feel for a vein. You're gonna start distal when feeling for a vein and work your way up. Okay, now that I have found my vein, I'm gonna untie that. Perform hand hygiene again. Put my gloves on. I'm going to open up my IV start kit and get all of my supplies ready. Tegaderm, gauze, tape.
Okay, well I know how to do this.
I'm going to tie this tourniquet back. And I'm going to clean the site with my hydrochloroquine. And dispose of this.
But that's what I know how to do this.
I'm going to connect my saline to my IV extension, unclamp it, and I'm gonna prime this as well. Make sure it goes all the way to the end, there's no air bubbles, and then we're gonna clamp that off.
I'm just gonna stick this over There's a whole bunch of
I'm going to insert my needle, bevel up, look for that flashback of blood, and advance your catheter. Once that's in, hold it down, and pop your tourniquet off.
No.
I'm gonna hold it and put that extension on. Unclamp the extension and be sure that it flushes. And it does. So we're going to clamp it back. And I'm going to apply my Tegaderm. Being sure not to cover where the extension connects to it.
Cause I gotta have Silas at school by 7:30, so.
There's a place here to put your initials, the date, and the gauge of the needle that you used for the IV solution. Once this is on, you could do extra measures to, you could put extra tape on to make sure that this stays in place. Are you having any pain or anything? No? Okay. I'm going to be observing the site for redness, swelling, irritation, anything that would show that it's not in there right, or she's having a reaction.
Go home.
Then I'm going to take my and I'm going to take an alcohol pad and vigorously scrub the hub. I'm also going to take an alcohol pad to this one and scrub the hub. Dispose of that. Once that is hooked to the patient's IV insertion, I am going to unclamp, and I'm going to count the number of drips per minute and set it to the correct rate that is ordered for this patient. Are you having any pain? No? You feel okay? Okay. So once the patient's hooked up, I am going to clean up my supplies. I'm going to dispose of my sharps in the sharps container. I'm going to be sure to come back and reevaluate my patient for pain and reassess the IV site again for any redness, swelling, pain, tenderness, and I'm going to report and record.